Good morning, everybody. Welcome back to the second annual Innovation Symposium. We're continuing with the economics track with our second panel today. To start us off, we have Dr. Elizabeth Barber, ALM 1989. She is a researcher and barrister. She's also the owner and founder of Barber Innovations, LLC. Our second presenter is Ramdan Kotamaraja, who is ALMM from 2010, my year. And he is the president and CEO of Novadia Systems and several other companies as well, I believe. He is an entrepreneur and philanthropist. And finally, we're going to have Cesar Marola calling in from California. He is an ALM from 2013. He is a senior manager for T-Mobile and is also the 2013 winner of the Derek Bach Prize. And with that, I give you Dr. Elizabeth Barber.
Thank you. Thank you very much for the opportunity to speak with you today. I owe Harvard a great debt of gratitude. I would say Harvard has touched my life for quite a number of years, probably most importantly when I did my undergraduate thesis at the University of Arizona and asked Andrew Weil if I could interview him when I was studying the mind-body problem. So now, all these years later, he's founded the Department of Integrative Medicine at the University of Illinois, and I will speak about integrative medicine and Parkinson's disease treatment with a plan I've developed over the last 11 years. So my goals are to empower everyone listening today to take better care of themselves and their loved ones by taking preventive lifestyle strategies. And while these approaches have ameliorated the patient's condition who I care for and kept her in her own home for 11 years, my individual statements are not intended to cure, treat, or prevent any disease, but the combination has appeared to be helpful. So what is Parkinson's disease? It presents as any combination of tremor, stiffness, or weakness by the sufferer, which worsens over time due to a progressive loss of dopamine. It's traditionally treated with the drug carbidopa-levodopa, which elevates the level of dopamine in the patient, although some treatments now start with a combination of dopamine agonists or MAO inhibitors to delay the onset of dyskinesias, which are exaggerated movements which normally appear somewhere around 7 years after starting the medication and can lead to falls in the patient. One rarely gets supplement advice from doctors. So how many of you in the audience have a blood relative with Parkinson's disease? And how many of you have had that relative tested with, by 23andMe or another organization to see if that disease is from a genetic cause? Nobody. So happily, only 10% of Parkinson's disease cases have been shown to have a genetic basis. So if anybody tells you it's higher, just don't believe them. Nutrigenomics and epigenetics are telling us that we can change our genetic destiny. So if you have a genetic risk for a disease, your lifestyle changes can improve your outcomes. And that's what I'm here to talk about today. So integrative medicine combines alternative medicine with evidence-based medicine, such as drug therapy. It focuses on wellness, lifestyle, and health, primarily with a view of delaying disease and emphasizing the patient-physician relationship. By delaying your symptoms, the patient can stay in his own home longer. Nursing homes cost about $80,000 to $120,000 per year. They tend to shorten the life expectancy of the person admitted into them. There is a higher risk of infection in them. There is generally a lower ability to care for the patient due to the number of residents. And in general, people want to stay in their own homes. And fortunately, 70% of elderly people do stay in their own homes right now with home care, et cetera. So integrative therapy is really recommended for Parkinson's disease in particular. This is a long slide, but it essentially says that if you incorporate a number of therapies into your lifestyle, you will have a better outcome, and exercise is the most important. Other helpful therapies are physiotherapy, occupational therapy, hydrotherapy, logotherapy, musical therapy, psychotherapy, and art therapy. The result will be that the person maintains an active life, healthy both physically and emotionally. These things take a lot of time, but even integrating just exercise into your daily regime will help considerably. So there you have it, exercise. Secondly, hydration, coenzyme Q10. This is controversial, but it declines as we age, and you can ask to have your levels tested. It has been shown to be helpful in some Parkinson's patients, and the one I care for also. Vitamin B6 supplementation is necessary if the patient's on carbidopa levodopa, as that can decline from the drug. B12 and folate levels also decline with age, and a decrease in these can lead to dementia, so they should be tested. I also recommend taking a multivitamin daily, although this can be controversial. It has shown improved outcomes with patients, but I would recommend an uncoated one because most coatings have aluminum in them, and aluminum can lead to the formation of Alzheimer's disease or dementia with Parkinson's. Similar thing. So my experience with Parkinson's was very much a crash course. Although my loved one had had the disease for 13 years, her symptoms were being managed. I was working overseas, since we're talking about being overseas. I had been living in London. I had lived in Spain before that, so I had really been a caregiver at about a 4,000-mile distance, I think it was, give or take. So at that point, she had had a caregiver, but I had no idea of the consequences of a fall. I didn't know what a fall risk looked like. I didn't realize that dyskinesias were a fall risk. And at that point, I had scheduled her meals and medication generally, but not specifically. So I made a little movie about the experience I went through over the last 11 years, and I will have my kind friend Ian help me with that.
Bathroom, we put up cheery artwork, beautiful print, and we've decluttered it and put up bars and a toilet seat, and it's just very decluttered so that there's always a clear passageway between the bathroom and the bed. We reorganized the room to maximize space, so there's always minimal opportunity for anyone to trip, and we moved the easy chair upstairs, which makes it easier to clothes. I put up a shelf so that we can have a place for spare clothes, and next to them we hung the jackets in the closet so that everything is easily accessible for all the caregivers. Notice that the space is decluttered from the chair, and it makes passing easy for everyone involved. This is the caregiver station on the right, which is where all the pills are, so that makes, and the records for what she needs and what she's had given to her, so it makes record keeping easier. And she's just passing the bathroom on the right, where you see bars and a raised toilet seat and happy artwork on the wall. Management is a big part of the disease, and we spend a lot of time packing the pill tray 2 weeks in advance, ordering medication, refilling the supplements, and just making sure everything is given in the right dosage. It's the 30th of January 2013, and she can still walk up the stairs every night, which is amazing, even though it's an effort.
So am I might not really have.
Very good. Very good. And at the top of the stairs is beautiful artwork and a bar for her to be steadier. Beautiful smile. Catherine was always a gifted artist, and in many ways, this picture that she painted captures the many faces of Parkinson's disease. Sometimes they're sad, but always they keep going to face the world with the different moods that they feel. And we hope that this journey has inspired you to keep going with your journey. Thank you. So, as you may remember, the film alluded to pesticides, which have been shown in the last few years to have a direct link with the causation of Parkinson's disease. So I feel very duty-bound to inform you all that there are certain foods that, which you may have heard of, that are, the pesticides are in the foods, you cannot wash them off. I'll get to that in a minute. So we need to avoid our toxic load in our foods. You should make your frozen meals in glass because the plastics can leach out into the food. Skip plastic bottles if possible. Invest in a reverse osmosis under sink drinking water filtration system. Costs about $250 to buy it and maybe another $100 to have it installed. I think it's a worthwhile investment for everyone's long-term health. Now, there was a study by, I believe it's the Federal American Cancer Prevention Group that assessed all of these foods to see which could actually have the pesticides removed. These foods could not have the pesticides removed even after vigorous washing. They include celery, peaches, strawberries, apples, domestic blueberries, nectarines, sweet bell peppers, spinach, kale, and collard greens, cherries, potatoes, imported grapes, and lettuce. So these lists are available online, and you can take a shopping list with you to the grocery store, which I strongly would recommend finding a grocery store that sells organic ones of these. It can be a challenge just to find them. The Clean 15, by contrast, can save you money because you don't have to go organic with these because they repel pesticides, or pesticides are not desirable to use on them in the first place. Those include onions, avocados, sweet corn, pineapples, mangoes, sweet peas, asparagus, kiwi fruit, cabbage, eggplant, cantaloupe, watermelon, grapefruit, sweet potatoes, and sweet onions. Now, I am running a bit short of time, so I'll just summarize to say that in the original Hippocratic Oath, Hippocrates said that diet was his first form of treatment. That was left out of the 1964 revision of the Hippocratic Oath, where they rewrote it to say only prevention. So that's why your doctor often doesn't know the difference between various diets. But they're happily studying diets. The Mediterranean diet, specifically increased olive oil and nuts, was associated with decreased cognitive decline in 19% of older adults. Calorie restriction, which doesn't mean eliminating calories, it means, say, cutting out 300 to 500 calories a day, is more effective than exercise at slowing primary aging, and it activates the sirtuin-1 gene, which is the longevity gene, which David Sinclair here at the medical school has done a lot of work on. A big part of my treatment plan was to be very vigilant about scheduling a variety of proteins. Now I only include grass-fed meats because they are antibiotic-free, pesticide-free. Portions should only be palm-sized. Include oily fish twice a week, chicken maybe twice a week, and pork and pork once a week, beans once a week. I would recommend including the plant-based diet more often, but if you can't part with meat, these are the sort of general guidelines I'd recommend. Every meal had a salad for moving things along, and it's just generally healthy. Dark green vegetable for its antioxidant qualities, a healthy starch, preferably sweet potatoes or quinoa, and fruit with probiotic low-sugar yogurt for dessert, rather than a sugar-laden dessert. Because refined sugar is bad for your gut, as I'll say in a moment. And always try to train caregivers, if you have them, in meal scheduling and preparation. So I'll include a handout of this. This is Andrew Weil's Mediterranean Diet Food Pyramid. It's a very useful piece of information. It's very busy, so I won't dwell on it, but I will ask Ian to put that up on the website for you. He kindly has given me permission to use his handouts. So to summarize what I did in the film, it was very time intensive, took a lot of time to declutter, implement calming colors, put in safety measures such as grab bars, flat carpet, raised toilet seats, bars on the walls. I was fortunate I had more or less a lifetime of interior design training from my mother and my own interest. But even so, it was very time intensive. So I am strongly recommending to start at diagnosis. If your loved one is diagnosed with Parkinson's disease, start clearing out the clutter. It'll just make your life easier in the long run. So colors also have a huge influence in the overall health of the patient. In this case, sage green and yellow, they're just very calming colors. And horticulture, the pictures in the film were of nature. Nature has a calming influence. These are all very helpful neurologically. Then art can have a huge effect on the actual neurological health of the patient. So I'd like to get quickly to intestinal permeability and PD. This is a relatively new piece of information. Okay, so all Parkinson's patients have leaky gut. You can Google it. It gets worse with NSAID lectins from GMO foods, another reason to avoid them. Antibiotics, avoid them. And it can be tested for with a lactose mannitol test. You can improve your gut health with bone broth, aloe vera juice, probiotics, fermented foods, and such as cheese, sauerkraut, and kefir. Useful text is Grain Brain by David Perlmutter. I recommend Brain Sustain. Other supplements, you have them on your handout. Resveratrol especially, an anti-inflammatory diet, eliminate refined sugar, helpful supplements, omega-3s, turmeric, ECGC, ashwagandha. Proteins, very important. As glutathione, they're doing a study on that. 30% of all Parkinson's patients have a decreased level of glutathione. And telemedicine, you should see your neurologist at least twice a year if you have signs of Parkinson's disease. So thank you. To my whole team, this is my team. Parkinson's is a team disease. I've been the point man, the point guard. And so every family should have a point guard. Try to get your family on board. Try to do things like record your family history. It's a great way to spend time with your loved ones. So I hope these things have been helpful, and thank you very much to Harvard, and I will be grateful to the education that I got here for the rest of my life. And if anyone has any questions, please contact me. My email is at the end, sunnylisby@gmail.com. Thank you very much. Okay.
So thank you, Elizabeth. Ian has some handouts he's going to pass around, and we'll start with Q&A. And so, Bill, go ahead.
I noticed, was that 1,200 milligrams a day of CoQ10?
That's what I had her on. There was a study that was just done to sort of debunk the study on which that was based. I had actually taken her off of that, and she worsened, and so I put her back on. So the latest study shows that CoQ10 is not necessarily helpful for Parkinson's patients. So I only have her on 400 milligrams a day now, because it is very expensive. But that's why I urge people getting their levels tested, because you can ask for that test. But I just don't think that it's wise to not take CoQ10.
Banana wasn't on any of the two lists. Did I miss it?
I think it's a thick-skinned fruit. Generally, thick-skinned fruits are safer, because they're not exposed to pesticides. So that's the general rule. Thick-skinned, non-organic is fine.
My husband has Parkinson's, and so we've been living with it for 6 years. The thing, and we've done all of this, so thank you, and I couldn't agree more. I mean, this absolutely makes a difference. And I would say, as far as the team, that I'm part of a group, we call ourselves the Other Halves. We're the wives of men who have Parkinson's, and they're all in like 40s, 50s, and 60s. So we're like young Parkinsons. And what we learn from one another is better than what anyone learns from the neurologists or the healthcare providers. So I just think, like, when you build a community, and like when you build a community, it helps you stay sane, and you learn a ton.
Yeah, it really helps to decrease the isolation and realize there are other people going through the same thing you are. Yeah, thank you.
Yes.
Thank you for that. Through my new project in energy efficiency, going into wellness, building communities, I'm exposed to a lot of research or looking into the aspect of our food having lost its nutrient value over the last 40 years or so. And when this started to come out, maybe 20 years ago, 20, 30 years ago, the USDA's response more or less was, well, it could be that our measurements, our technology has improved so much that we're measuring better and different. And so the difference in the loss that we see from the 70s to now could be pegged on that. Could you say a little bit more in terms, or could you comment on that to maybe there might be a
Difference in the measurement systems?
well, not that. I mean,
The loss of nutrients?
These diseases that we're seeing that are, modern diseases, for lack of a better word. Is there, I mean, you talked about diet in terms of the first go-to kind of
Yeah, and I absolutely believe that's true. I am one of the few people in America probably who has an archaeological study of food pyramids in the United States from the 60s compared to food pyramids now. And there was much more refined sugar. White bread was on our food pyramid in the 60s. And I do believe that those things have dramatically contributed to diseases of aging, in particular obesity, Parkinson's, Alzheimer's. So the nutrients in our food have decreased, definitely. Well, I mean, I can't say definitely, but based on the farming and the reports. And I think it's because we keep farming and depleting the soil. But even though that's true, I would still choose a tomato of today over, anything processed or refined. I mean, I would take a GMO tomato over, a Snickers bar, or I shouldn't pick on Snickers. I probably got through college because of them, but anything with refined sugar in it, you should avoid. It's bad for your gut health, and 80% of our immune system is in our guts. It also contributes to obesity, which contributes to dementia. So, go organic if possible. I'm pretty sure if you compare a tomato of the 1920s to a tomato of today, today's would be less nutritious, but it would look a whole lot better, probably. It would be bigger. It would be more beautiful. You would be more likely to buy it. That's because of genetically modified foods. They can make them more beautiful. But so I would still get I would rather take a GMO diet full of fruits and vegetables than a diet full of processed food and refined sugar any day. But going organic is the best, absolutely.
Let's go to Mike in the back.
In a way, it relates to Dean Lambert's talk this morning, where it used to be in the U.S. A large majority used to be farmers, say around 1880, in the 1800s, and now maybe 2% of the population supports 98%, but they do it using mechanized tractors or pesticides or some form of modern methods of production, and then as a result, maybe that impacts the quality of the food, which maybe helps create some of the things that you've been talking about. So in a way, it's almost the price of progress, where now a very small percentage of the population is producing food for the vast majority.
Yes, I think that's absolutely right. We have some very dear friends who are farmers, and they have, fortunately, cabins on their very modern tractors to protect them from the fumes, from the pesticides and the other things they're exposed to farming. And their livelihood is farming, and so I just don't get into the whole GMO versus non-GMO discussion with them, because I respect very much that they're farmers, and as I said, I would rather eat a GMO thing rather than a processed food item. But yes, there are far fewer farmers. There are more organic farmers now. There is this law that you have to wait 3 years to use land before your food is grown, and it can be called organic. So the people who grow non-GMO food tend to say we need the yields for the planet. The organic people tend to say that's not true anymore. I think there's probably a happy medium there somehow, but I think that if our food, so I'm not sure what your question was exactly, but
it was
okay.
more that
so yes, it's a challenge.
It's
a challenge to get into this more organic food supply because we have so far fewer farmers. But it is being done. A friend of mine in Chicago is starting something called Iroquois Valley Farms, where they're selling organic land to farmers to try to increase the number of organic land and the amount of organic land that's available to farm on.
I suppose what I'm commenting on you're talking about the disease, and that's very, very important. It's also connected to something much deeper within our modern systems of production. Like, I had a friend in Italy who was talking about the slow food movement, and she was saying, well, food should be grown locally, and it should be organic or non-processed. And I said, and she said, that's the way it should be. And I said, you're absolutely right, that is the way it should be, but if that's the way it's going to be, then most of the world's going to starve.
That's
because
right.
You're not going to produce, so, you can feed everyone, and then they're not going to have the best food, let's say, and unfortunately we're going to have situations like this, but at least they're going to be fed.
Yeah, I think the most important thing is to have people fed. I think if consumers have a choice, they should buy the food which is healthier for them. It's not really for farmers to make a living, they have to grow a certain amount of food. That's why one of the reasons there's only 2% of the population farming. It's just a very difficult thing to be a farmer and making a living at it. And but we can't. The people that make these decisions can't expect us to sacrifice our health for their, designing the food. If the food is bad for us, just don't buy it. And eventually, they'll say, okay, nobody's buying our food. We'll have to make more organic food. So anyway, I think that's the answer. We have to be rebels, and we have to speak as a people that these things are not acceptable to us. It's not acceptable to us to, spray pesticides on everything, for example. So.
Also relates to Lois's point about being rebels in a sense.
Yes, I don't like that word because it tends to stigmatize people, but I think that one has to speak up for whatever the problem is and act as a group. So the Parkinson's community is doing that. We're acting as a group. Parkinson's the PAN activists, the Parkinson's Activist Network, or in DC, I was an advocate for them, and we lobbied Congress for funding. But I believe that the problem needs to go with everyone, not just the Parkinson's people. We all have to be more concerned with our food and our wellness, because we can't expect a pill to solve our problems, because it won't. All the Alzheimer's drugs have failed, for example, and most of the other ones. So we have to do it ourselves. We have to take control of our own health. So thank you very much. I very much appreciate your attention today.
Let's give Elizabeth a round of applause.